If you've ever gone to the hospital and your doctor pulls out this thing that looks like a hammer and begins to tap on your knee, your ankle, or another part of your body, don't be scared. That's not a hammer. But what they're trying to do is they're trying to test your reflexes. And one of the diseases that gets checked in this way is something known as myasthenia gravis. Myasthenia gravis causes muscles that you would normally be able to control. Myasthenia gravis causes your muscles to get really weak and tired very quickly. A good way to break this down simply is imagine normally when you type a message and hit send, it goes through instantly. But with myasthenia gravis, it's like having bad Wi-Fi and the signal keeps dropping and your messages don't always go through properly. And sometimes you have to keep retrying and retrying, and over time the connection gets even weaker and weaker until you give it a break. And once you give it a break, it temporarily improves, but then the weak connection problem is still there. If that sounds like Verizon, well, no, it's not. And so with this disease, doing simple things like talking, chewing, or swallowing becomes really difficult. If you're a patient with this disease, here are a few things you can do to better take care of yourself. If you're a patient with this disease, or if you know somebody who has this disease, here are a few things they can do to better take care of themselves. Swallowing food will become a lot harder, so you need to make sure that you're eating softer foods or taking smaller bites. And if it's too much and you don't feel like chewing, then you may want to drink thickened liquids like smoothies. Also, prioritize taking breaks in between activities. So make sure that you're able to sit down even when you're doing simple activities like cooking or brushing your teeth. Another thing that happens with this condition is that it becomes really hard to keep your eyes open. So your eyelids will droop over your eyes, and when this happens, it can affect your vision and you'll probably need to get an eye cover or get glasses. Stay healthy.